Rahim. So let's move ahead and let's talk about multifocal atrial tachycardia, right? So in multifocal atrial tachycardia, there are basically multiple foci in atrias, right? And because of that multiple foci, they will be firing at variable rates and they're going to cause the tachycardia, just like that of atrial fibrillation. So we're going to find multiple foci in the left atria in atrial fibrillation, right? And they will be firing at different rates, and that's how they're going to cause the tachycardia, right? So multiple focal atrial tachycardia is seen in mostly COPD patients, right? And that happens mostly because of the pulmonary artery hypertension and stretching of the right atria, right? And this can also happen because of overuse of theophylline. This can also happen in sepsis patients. So now let's talk about clinical features. There will be a smoker patient, right, elderly patient, which will be complaining of palpitations and dizziness and syncope, right? And all of these will be because of the um, decreased cardiac output. Syncope and dizziness can be happen because of that, right? So on examination, we're going to find the unconscious patient, and if we check the blood pressure, so blood pressure will be low in these patients. So the one thing that we're going to get in these type of patients is irregular pulse, just like that of atrial fibrillation patients, right? So we have two differential diagnoses of that. If we find irregular pulse, one is called as multifocal atrial tachycardia, another one is atrial fibrillation, right? Okay, so on ECG, if we get the ECG done, right, so ECG will help us to differentiate between atrial fibrillation and multifocal atrial tachycardia. We're not going to find any P wave in atrial fibrillation. There will be some fibrillatory waves. These are called as the F waves in atrial fibrillation. While in multifocal atrial tachycardia, right, you're going to see the multiple morphologies of P wave, just like I have drawn here, right? So you can see the multiple morphologies of P wave, right? And there will be varying RR interval. So you can see RR interval here. Let me draw it here over here. So it will be RR interval will be varying, right? So it will be varying RR interval, right? And also PR interval will be varying, just like you can see here. This is a PR interval, right? This is a PR interval. It's a bit prolonged here, it's a bit short here, and more short here, right? So PR interval will be variable, right? So for diagnosis of multifocal atrial tachycardia, we should have more than 3 morphologies of P wave, and heart rate should be more than 100 beats per minute, right? If heart rate is more than 100 beats per minute, and we're going to see the more than 3 morphologies of P wave, we're going to call it a multifocal atrial tachycardia. While if heart rate is less than 100 beats per minute, right, and we are getting more than 3 morphologies of P wave, that is called as WAP, wandering atrial pacemaker, right? Okay, so for diagnosis of MAT, we'll have the more than 3 morphologies of P wave, irregular RR interval, right? So you can see irregular RR interval, and there should be variable PR interval. So we can see the variable PR interval in this case, and there should be right axis deviation, right? So I have described that in axis calculation part, that will have, if we draw the axis, so axis will be around minus 30 to 90 degrees, right? So it will be here. This is called as normal axis. If we find axis in this direction, that is called as left axis deviation. And if we get the axis here, this is called as right axis deviation between 90 to plus 90 to 180, right? And if we find 180 to minus 90, so it will be extreme axis deviation, right? So axis will be falling in this direction in these patients, right? Okay, so for treatment, we have to first control the rate in these patients by using IV verapamil, that comes with the name of brand name, that is isopten, right? 5 mg. We can give IV stat, or if it is not available, we can go for the IV metoprolol. And for prevention, we're going to use the oral verapamil in these patients, right? So that's all about the multifocal atrial tachycardia. So we're going to differentiate it from wandering atrial pacemaker and atrial fibrillation. That's all for today.